Hey everyone, Dr. Boyd here. Welcome back to Parently. We encourage you to join us. We have a lot of information about pregnancy, about the ultimate delivery that we want you to experience. But it's up to you. You have to click that button before you can join us. Today we're going to talk about your birth story. Now, in any preparation with anything in life, you have to prepare before you get there. If you don't prepare, when you get there, oftentimes it's not what you want it to be. So the process starts when you get pregnant. And as you move through your 9 months, your 40 weeks gestation, a story will develop. So I want to kind of break this down into two parts. Your pregnancy story is what you experience as you go to your doctor, the first time your baby kicks inside your uterus, your first ultrasound. All those things create a story. But we want to concentrate specifically on your birth story. Now, the birth story can be positive, and unfortunately, it can be negative. And it can be negative for many, many reasons, things that you have no control over, whether you end up after delivery bleeding, or after the process of a long labor, you end up with a cesarean section, or after the process of a cesarean section, you develop an infection, or you have a difficult vaginal delivery, and now you have a problem with incontinence or loss of urine when you cough or sneeze. Those all create a birth story. But let's concentrate on two parts, the positive birth story and the negative birth story. As human beings, the more information that we know, the less anxiety you have. So when you tell your birth story, when you go through your birth story, you're not only benefiting yourself, potentially you're benefiting other women. And that's why creating a birth story is so important. But again, you have to think through the process. So a birth story starts when you start labor. And we've got multiple videos on the initiation of labor. And as you move through the process of labor, from false labor to early labor to active labor, and then to your delivery, a story will be created. And if you're not paying attention, and if you're not thinking through this process, at the end of the story, or at the end of the process, you don't have a good idea of what happened. And this can be very, very frustrating for you as a patient, and it can be frustrating for other providers moving forward. It's amazing how many patients that I asked through my career, why did you have your cesarean section? And many patients don't know. No, they may say, well, I think I got stuck, or the baby got stuck, or I never dilated, but they don't have a clear-cut pattern of why they ended up in the situation that they did, because they did not create a birth story process for themselves. So again, the birth story is important not only for you as you think through the entire process of why you ended up in the position that you did. It's so very, very important for future care with future providers. So again, think through the process of labor. Think through the process of why you ended up in a delivery situation, either vaginal or cesarean section, and ask questions. You may not be able to ask questions at the time, but your physician will answer those questions the next day or the following day if you ask them. Now, I fully appreciate that not every physician, not every healthcare provider is a good communicator. Unfortunately, as men, sometimes we don't do a good job of communicating to our female patients exactly the process, because we as men will never ever experience labor. But that doesn't mean we don't understand the process of labor. And I love to talk about your birth story, about why you ended up in the situation that you did. So let's break that down, the birth story, into two components. After the process of labor, you eventually are going to be delivered in some fashion. But it's only two possibilities. You're either going to deliver vaginally, or you're either going to deliver by cesarean section. There's no other option, one of those two options. So if you have patient A, and she goes through labor, and she delivers vaginally, was the process of her vaginal delivery complicated? Was it complicated by a long labor, a long pushing? Were you delivered by forceps or by vacuum? Did you have a tear? And if you had a tear, what kind of tear? Did you have a first degree, a second degree, a third degree, a fourth degree tear? That's all part of the birth process, and that is your birth story. Let's take patient B. Patient B ends up with a cesarean section. But why? Why did you end up with the cesarean section? I encourage you to think, start the process of my birth story begins when I start labor. Process this through. If you have to write information down, have your husband write information down. Ask questions of your nurse. Ask questions of your doctor. As you get to the end and you have a vaginal delivery or cesarean section, if you don't have the ability or time to ask questions at that time, ask questions the next day. And then as you move forward from being admitted at the hospital to being discharged, did you have problems at home? Problems urinating, problems with losing stool, problems with infection, problems with bleeding. Those are all part of your birth process. 80% of all women have a positive birth story that they can relate to. So create your birth story in your mind. Start early, process through the delivery process, and at the end, look back and figure out what happened to you and develop that birth story. It's very, very important. At the end of the day, you'll be happy you did that. All of you know that Parently is the best source of information for you as a patient moving forward. We provide pregnancy information, labor information, and now a new topic that I want to address today, fourth trimester education. Many of you have never heard of this term. It's a new term over the past several years by the American College of Obstetrics and Gynecology. All of you know that pregnancy is made up of your first trimester, second trimester, and third trimester. But what happens after you deliver? Many of you wait until that process occurs before you even think about it. But I encourage you, we have to think differently. Many of you think about pregnancy before you get there. You think, should I be on a prenatal vitamin? You start that process before you get pregnant. So this fourth trimester discussion is very pertinent to all of you that are pregnant right now. So let's address this starting in our second or third trimester to think about what you as a patient need to consider in your fourth trimester. ACOG, the American College of Obstetrics and Gynecology, addressed the fourth trimester issue in 2018. They say that the fourth trimester should be an ongoing process. Historically, once you deliver, you go home and your OBGYN says, I will see you in 6 weeks for your 6-week postpartum check. They typically do not see you in that 6 weeks unless you call and say, there's an issue, doctor, I need to come in. So it's kind of a checklist of one and done and you're done. But we now know that that is not good health care for you as a patient in totality. The process of your fourth trimester starts right after delivery, and we need to educate you before that process occurs about what to think about. So this is an ongoing process. It can last up to 42 days, which is your 6-week postpartum visit, because the pregnancy, by definition, the puerperium or the postpartum period is 42 days long. So that means emotionally, spiritually, psychologically, and physically, your body is still in a pregnant state, so to speak, until that 42 days ends. So let's think about issues that you need to address. First of all, let's address mood. Mood is one of the most difficult subjects to address and get prepared for, because what should I expect if I've never been there? It's hard to understand that. When you're pregnant, you have massive doses of estrogen. Estrogen typically makes you feel good. So many women, because they're pregnant, they have large doses of estrogen, they're happy, and then delivery occurs, and your estrogen levels fall dramatically. Low estrogen levels, just like in the menopausal woman, can make you feel depressed, can cause you to have increased anxiety. You can cry all the time. You feel terrible. You're fatigued. Many of those situations are not addressed beforehand, and you need to think that this could happen to me. So that would be a topic that you need to talk to your family about. Mom, sister, did you guys have problems with severe depression, severe anxiety after delivery? Because oftentimes you will follow that same pattern. But be prepared. Who's going to take care of my baby? That's an issue that sounds so crazy to even ask, but what happens if my baby cries all the time? What happens if my baby has problems nursing? It takes a village to raise a child. That simply means you need people in your life, your mother, your sister, your friends, to help you. If you're so exhausted that you and your husband can't do anything but sleep, who's going to come in and help me? So those are issues that you need to think about. Sexuality and birth control. Now, unfortunately, men can be very, very negative in this scenario. Sometimes men don't have sex when you're late in your pregnancy, and if you've had a complicated labor, complicated delivery, a cesarean section, sex may go down the multiple weeks before you have the ability to have sex or even want to. Those issues need to be addressed with your spouse before you get there. You say, honey, if I have to deliver a baby through my vagina, I may not want you there for a while. But again, talking to him about that is important. If I have a very difficult delivery and I tear really badly, you may not be able to have sex for 6 weeks, 8 weeks. He needs to understand that. Most women don't have problems, though, with a difficult delivery, but you do need to address birth control. Up to 70% of all women can ovulate by your 3rd week after delivery. So think about this. As obstetricians, we typically did not see you until your 6-week postpartum check. Most couples resume intercourse at the 4-week mark. That means there's 2 weeks there that you are not protected with birth control. And that causes potentially an unwanted or unplanned pregnancy in that period of time. But again, if you're not addressing it, if you're not thinking about it, if you're not talking to your healthcare provider, that 4-week mark comes along, you've ovulated, you get pregnant, and now, oh my word, how do I address that? So be thinking about it. Sleep and fatigue. I mentioned this a little bit ago, but you have to understand your baby is their own person. They may or may not sleep well. They may sleep terrible and they're up all night crying. How do you address that? Well, you got to plan for it. You say, my mother, sister, friend, husband, he may need to take more time off than the typical 2 or 3 days. Men can get FMLA just like women can. That's the Family Medical Leave Act. It allows the husband to take time off just like you as a patient. And if you need more help at home, you say to your husband, you need to consider FMLA. The physical trauma of delivery, you need to think about. What happens if I have a difficult delivery? What happens if I have a severe tear, a 3rd degree or a 4th degree? What happens if I have my belly cut open with a cesarean section? How is that going to change my 4th trimester? Nobody wants to think about that, but if you're not thinking about it, that happens, and then you're, oh my word, what do we do? And the medical diagnosis for loss of urine is called incontinence. That simply means the involuntary loss of urine when you cough or you sneeze. There are several types of incontinence. I don't want to go into those because those are rare. But stress incontinence is the type of incontinence that occurs after a complicated delivery where a woman coughs or sneezes, gets up off the couch, and loses urine. What can cause this? A complicated delivery can cause this. What is a complicated delivery? That means a baby that is very large coming through your birth canal. and it can take a while to get out of the birth canal. But even a quick delivery, where the baby comes down very, very quickly, sometimes can cause disruption of the normal anatomy around the bladder, and that can cause incontinence after delivery. There's also instrumental delivery that can cause a complicated delivery. So if your baby gets stuck in the birth canal and your obstetrician recommends either forceps or a vacuum, sometimes that can cause loss of urine after delivery. The type of tear that you have, whether the tear was a first degree, second degree, third degree, fourth degree, or whether you tore around the urethra, which is your P-tube, those can also cause potential issues with your bladder. So a complicated delivery, a big baby, those set you up for an increased risk for incontinence after delivery. Now, I am here to reassure you that this is usually, when I say usually, 98 or 99% of the time, this is a self-limited process moving forward. So that means month 1, month 2, month 3, maybe even up to 6 months after delivery, that should get better and ultimately resolve. What can you do as a patient in the meantime? There's something called Kegel exercises. Kegel exercises contract the muscles around the P-tube, called the urethra, that will help you improve this loss of urine. How do you do a Kegel exercise? You sit down on the toilet first thing in the morning. You start your stream of urine and you squeeze to completely stop it. That's 1 rep, just like in weightlifting. You do that 10 times. So you start your urine, you stop it, 1 rep. You start your urine, you stop it, 2 reps. You start your urine, you stop it, 3 reps. And you go all the way to 10 reps. You do that several times per day. You have to do it every day whenever you have stress incontinence. Otherwise, it doesn't benefit you. Then as you learn which muscles to contract, you can then do it just sitting in a couch, driving down the road. You can squeeze those muscles and do your Kegel exercises. Now, moving forward, for women that have had multiple babies, you have a greater chance with each baby, especially if they're big babies, of having long-term incontinence after you've had 3 or 4 or 5 babies. So even in that scenario, this is good coaching for you so that you learn how to do Kegels throughout your lifetime as a woman. It's important, though, to remember, after traumatic, complicated delivery, most women resolve their urinary incontinence. It's important, if you do not have resolution of your stress incontinence, that you see your obstetrician gynecologist. They may feel comfortable managing this. Sometimes, rarely, you have to have surgery. If your OBGYN doesn't do this, he may refer you to a urologist or to a urogynecologist. Now, those patients that have chronic disease, diabetes, hypertension, you need to plan to see your primary care doctor that takes care of you. You need to see that doctor at the 3 or 4 week mark or sooner, but you need to call their office and say, hey, I'm delivering on such and such a day. Don't know if I'm going to have a vaginal delivery. Don't know if I'm going to have a cesarean section. When do you want to see me next? Very important that you address that before you get there. So let's look at the entire scenario here. 4 trimesters. 3 trimesters, you're pregnant. You have a baby inside your uterus. The 4th trimester is equally as important for you as a patient, equally important for your baby. How do we address both of you in the safest manner possible? We can help you have a very happy, healthy, safe delivery process. It's a preparation process. When you're pregnant, you eat healthy, you exercise, you get adequate sleep, you see your healthcare provider on a regular basis, you plan for a successful, healthy, happy delivery. We know in medicine that the mind is a great controller of you as a patient moving forward in your physical care. So the mind can benefit the body. When you get into your 4th trimester, we equally equally want you to have a safe, happy, healthy postpartum period. We know that we can help you in this scenario as well, but it starts with, I'm going to have a good postpartum period. If I have problems with moods, I'm going to address it with my provider. I'm going to address it with my family, my spouse. Be proactive. But when you get home, life has changed for sure, but it's not a disaster. It's simply a process. And you start your process immediately. When I get home, I'm going to try to get adequate sleep. If my baby's causing me problems with sleep, I'm going to talk to my spouse. I'm going to talk to my family to help me. I'm going to exercise. I'm going to get out every day. When I get up in the morning, I understand you're taking care of your baby, but you need to get up and get dressed, take your shower, try to eat something, take your prenatal vitamin, and then get out of your house. Staying in your house day after day after day is problematic. When you're at home, if your window shades are closed, open them up. Let light in. We know light is beneficial for you. We have many, many other positives that we can help you with at Parently. But these are a few very simple things that you can do in your 4th trimester. Come join us at Parently. Come help us help you have the delivery that you need.